This is Dr. Mushira Enani, ID consultant from King Fahd Medical City, Riyadh, Saudi Arabia. Today, in celebration for the World Antimicrobial Awareness Week, I'd like to share some story from the day-to-day practice as ID consultant. These stories come mainly from intensive care unit consultations. We get referrals to see patients who are really septic with a severe infection, whether it's a pneumonia or urosepsis or line-related bloodstream infection. And when we review the cultures, we find that they have acquired a highly resistant organism, which is extensive drug resistant or even pan-drug resistant. And if we lose the last resort antibiotic like carbapenem or colistin, we end up by having no weapon to treat these patients, and we find a big challenge in choosing the right regimen, and sometimes we fail. So this is called the AMR, or antimicrobial resistance, and that's why the WHO has declared that AMR is a global public health threat. It's not only in one nation, it is across the globe. And to tackle this global problem, we have to have a global approach, and we have to have a multi-sector strategy. So that's why the slogan for this year awareness is united to preserve the antimicrobials. And we have to take care and handle antibiotics with care.